The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Samuel's kidney transplant and Neda's heart surgery continues. Eight-year-old Neda was born with a hole in her heart.
Leg and a little cut about so big, no stitches.
Doctors had planned to repair Neda's heart by patching it with a plug.
The hole and put this little plug in, and that will close the hole.
But discovered the hole is much larger than expected.
Too big. Because the hole was too large to close. She'll have to have that closed surgically.
Today, Neda will have open heart surgery to close the hole. The operation presents more risks, but it is critical to Neda's long-term health that the defect be repaired.
Neda, I need you to put this gown on, and I need you to take your earrings off, and if you have any other jewelry too. And you don't have any nail polish or anything on? No? I just have some medicine for you to take. It's kind of chocolate flavored. Yummy. Yeah. I don't think it tastes as good as chocolate though, unfortunately. But it's gonna make you feel a little bit sleepy, so that's why we have to send you down on a stretcher too. Okay? You ready? All in one gulp, or do you want 2 gulps?
2.
2? Okay. Okay.
Okay, you have to
Just
swallow
swallow it quick, because the longer it stays in your mouth, the worse it tastes. And we'll see you when you get back upstairs with it.
Don't worry, you can't crash. It's cold.
Three-year-old Samuel Mehta and his parents have traveled to Toronto from their home in Saskatoon. Samuel was born with prune belly syndrome, which has resulted in chronic kidney failure. He has already had 1 kidney removed, and for the last year has needed dialysis to survive. Now, Samuel needs a kidney transplant.
Just doing you, Daddy?
I guess, yeah.
You're Francis?
I'm Francis.
In less than a week, his father Francis will also undergo surgery so that he can donate a kidney to his son.
Hello there, handsome. Hello. You think you'll lie down on Mommy for me? Can you lay down? Lay down on Mommy. You're gonna have a big kidney in here, huh? So usually they end up putting them in the belly, kind of on this side or on that side, and they're right instead of behind where his other kidney is. Often they end up putting them in the stomach, the stomach area
so
there.
The incision would.
Yeah, the incision is usually midline.
Okay.
How long has he been on his dialysis for? When did he start?
January of '99.
His meds?
Diavite, sodium chloride tablets, 3 a day, folic acid, calcitriol,
And what else?
ferrous sulfate, 0.8,
Okay.
oxybutynin. He's on growth hormone.
So there's a lot of these things that he won't be needing after he gets his transplant.
That's right.
Yeah, but he'll go for his line today. Don't worry. Once he has his line, none of these issues will. It's great. We can do all the blood work from his line, and he'll be better.
Okay, honey, don't be scared, okay? Just lots of blankets. Okay? Please, come on in. Lots of stickers. We're gonna put stickers on.
Now, if we hit the TV, fair enough. Perfect. Okay, guys, thank you very much. Thanks for your help. Fabulous. See you later.
So we're making a tunnel for the catheter to go under the skin.
Put it on. Want to put it on?
It's like an elephant one. If they think your head's as big as an elephant's.
Mine, no.
Yeah.
Good morning, Neda. My name's Karen. I'm going to be working with Dr. Van Arsdale today, and I'll be the one taking you into the operating room. You understand what's going to happen today? You're going to get your heart fixed? Okay, well, we're all ready to take her in. Yeah, this is a good time to go. Go for a little ride down the hall. Okay, that's a girl. Very well, Neda. Good girl.
Yeah, we're all finished.
Went good. Oh, got a line in. He's very stable during it, and he's just waking up now.
Can
we go in then? Or? You wait here for the moment. He's from our area over to recovery, and when he's awake enough, then these ladies here will bring you in to see him. Okay? Thank you very much.
You're welcome.
You're welcome. Take care.
Thank you so much.
Thanks a lot.
It's good. Away we go.
Here we go. See mommy, okay?
It's going to be a long day. Sitting down and waiting like this is hard.
It's okay to start? This little girl has a very long sternum, which makes it harder to do a smaller incision. So we make a fairly small skin incision, but we still do a lot of dissecting and opening up inside, so that the actual bone incision and so forth is much bigger than what the skin incision is. And it is a very generous-sized hole. This hole is probably about 2 by 3 centimeters in size, which explains why she has a big heart. Now we try to make sure there's no air on the left side of the heart. Go ahead and puff. That's good. And hold. Is that better?
Who's there? I'm Peach. Pichu.
Hi, Sam. Does he know what's going on, do you think? Have you talked to him about this?
Not.
No, we don't usually.
I mean, he knows
Don't you?
about a transplant, but
Sam, can I feel your tummy?
cold.
Cold.
Can you do that?
Breathe. Breathe in.
You certainly are a bunch of tubes, aren't you?
Ow.
Where does
Oh.
it hurt? Oh, don't scratch there.
Who did it, Mummy or me?
He did. He scratched himself. Where his
Okay.
line is there.
How do you control the pain for him after?
You'll be on a morphine infusion, as you probably will be too.
Hey.
Wait. Just a little bit.
Whoa, that's strong.
I know.
Hey, hey, hey.
Right. Ah.
Well, you're moving too much.
Dan,
Done.
is it Daddy's turn to get a poke?
Oh no, no, my turn.
Mommy.
Here, right here.
Dad.
Okay.
Okay.
Ow! Did you do it? Okay, do it gently. That's okay. She had a pretty good sized hole, probably almost that big, which is pretty big for the inside of a child's heart, and we did put a patch on it.
So did she need any blood or anything like?
I'll have to check with the anesthesiologist about that, but so far I'm pretty sure we haven't given anything. And the heart seems to be working fine. We have to wait and make sure she wakes up okay, and hopefully be ready to go home in about 2 or 3 days. Okay? Thank you very much. Things are fine. Okay, fine. Thanks.
A little bit cold because the operating rooms are very cold. Okay. Mm-hmm.
Okay, I just wanted to go through Monday and Tuesday just so that when you come in. Tuesday morning, both of you go downstairs probably sometime around 7:30. You'd be in surgery for about 4 hours, and Samuel, he will be 6 hours, maybe 7 hours, and then he will go to the intensive care unit. They'll get started with Samuel right away, and they'll kind of start to prepare the area for the kidney, so they'll isolate the vessels and look for them, and then so that they're ready to hook the kidney up when it does come out.
I get quite nervous, even to look at like yesterday when we were at Central Line and we get to see the room. That's too much for me to take. So I was wondering if Christina could go with him.
To go into the room with him?
Yeah.
Ah.
Because, kind of scared, so I don't want to see anything.
Just let me say, expect to be sore. And people wake up and they're scared because they feel so sore after the nephrectomy. It is a painful surgery. You do wake up feeling very sore.
Yeah, Sammy wants to share his blankets.
Put it back. Probably cool. Are you
Is Daddy
cool?
cold? Is Samuel cold?
Dad, I'm Dr. Brown. I'm one of the anesthesiologists who are going to give your anesthetic. Any questions about your anesthetic today?
Just kind of nervous of that look of the OR. I don't like to look at those things.
A little fear is, I think, totally natural.
For this little guy, he may be asleep long before Dad is because he's got direct access already. You're almost asleep now. Are you sleepy? So yeah. Well, it's a good thing Mom's coming with you, so you won't be so scared. Hey? Too bad Mom can't go with Dad. Maybe Dad's more scared. Yep. But I've been told to come ahead with him, so I'll just phone and make sure, and we'll probably be taking him in now, and you'll be coming with us. Found out? Okay.
The blessing of the Lord be upon you. We bless you in the name of the Lord. May the blessings of the Lord be upon you. We bless you.
All right, sweetheart. We're ready to go.
All right.
How soon are you taking him in? Okay, well, you better. That's it. Thanks, sweetie. Go this way. Which way? That way. Here's the door.
Yeah.
Bit of a delay.
Wanna walk? Yeah? No?
You can walk, come on, it's not that far.
You can hold hand, that's okay. That's nice. And if you are tired, you tell us. We ask for chair for you.
She's done terrific. 2 days only after her surgery, ready to go.
You lost your voice again?
I don't know. She's not talking at all. Looks like they did something to her tongue.
Come on, Neda. Tell me you want to go home. Yeah. Okay.
Yeah.
Okay, great.
You're gonna get your daddy's
Can I just go to sleep? Swim round. No, this is just a little bit. It's all part of the suit, the magic suit. Okay. I'll tell you when he's gonna go.
How about a bit of nap? Take a bit of nap.
Very nice.
There you go.
There you
Okay,
go.
so
That's
that's
just
drip. We're just gonna. Okay.
That's perfect. Mom, thank you very much. You're very helpful.
Okay,
We're
that's
just
fine.
taking over the breathing here.
Okay, just a little needle poke here. Your back is frozen, so you might just feel it a little bit, okay?
Out through your mouth.
That's it.
Perfect. Jen's there if you need it, okay?
Okay. Take some big breaths, Dad.
Okay? Try and stay still. Try and stay still. He just wants to lie down. Yeah, he wants to lie down. Right back.
That probably feels better, right?
Oh,
See you when you wake up, okay, big guy?
That's the kidney there. Scissors, please. So that's what a dysplastic looking gnarly kidney looks like.
You're going to put this big thing called the kidney in the middle of the field. And that's the challenge for the operation.
I heard you were here. Well, everybody's draped and ready to get started. Okay. So your little guy, he was fine once you left him, of course. He was asleep.
Okay.
And your husband's epidural and fine. He's asleep too. They're both draped and they're just about ready to get started. Okay?
Okay, thanks.
This guy's huge. How much does he weigh? 97 kilos? Okay. Knife, please. What kind of work does he do, this guy?
He's a pastor of a church.
A pastor of a church. What's he so muscular for? Of the two operations, this is the one that's more nerve-wracking. Everything has to be so perfect for this kidney to work. And you can see the kidney right there. Can you see that? Yeah. The kidney is one of the organs that has the most blood supply in the body. So it's prone to excessive bleeding. If there's any error or if there's any injury to any of the important vessels, it's a significant bleed that you face. And they're not easy to control. Okay, that's good. Now, let's get that vein. Let's take the scissors, please.
Okay, are you ready for me to take that stitch out? And it hurt a little bit. I'll show you. I use a pair of tweezers and a pair of scissors, and I cut the stitch and we just pull it out, and that's it. That's it. Oh, I know. That one pulled. Everything looks really good. It's just gonna have a little dot of blood. Has she been talking at home? You're very quiet. Okay, Neda, you need to just try and do a bit more exercise. She can do things with like climbing her hands up the wall, just to try and stretch some of this out. Just no sudden movements or pulling up by monkey bars or contact sports for the 6 weeks, and no bike riding.
3 months after open heart surgery, Neda has fully recovered. By having the hole in her heart repaired, Neda will be able to continue to enjoy an active and healthy life.
Okay, all right. Can somebody mark the time, please? Artery clamp is on. vein clamp out.
How's that now? How's the flow now?
None. I'm putting some pressure on the bag.
This accessory artery isn't really flowing very well. And I'm right in it, and I'm just not getting any flow through it. I'm right in it.
Nothing.
Is it going now? Is it flowing now?
No.
Okay, have I got any flow now?
No. Hang on. Almost 7 minutes.
Doctors have only minutes left to flush the kidney. Clotting must not begin, or doctors will not be able to complete the transplant. And Francis will not be able to save Samuel from the consequences of kidney failure. On the next episode of Life's Little Miracles, Samuel's kidney transplant continues and Stephanie's knee surgery.